Welcome back to GMT. Now, you all may be wondering if I'm cycling, going anywhere. I'm actually sitting in the comfort of my own home, or should I say, the hospital. So, Dr. De Bique will be going through what benefits we have for this. We'll do one more myth, just in case anybody was wondering anything else. Dr. De Bique will answer that question for you. And then, of course, we'll go into the activities that we can see for Physiotherapy Awareness Day. So, Dr. De Bique, tell me, one more myth.
Um, I have back pain. I shouldn't be exercising.
I have back pain. I shouldn't be exercising.
Is that a myth?
I want to say yes, but I must make a confession that has been an excuse of mine as well.
Okay.
So tell me.
So actually, as you move more, your back gets healthier.
Really?
Because that's the way that blood gets to the area to help the muscles to recover. It gets to the nerves to help you to reduce some of that sensation issues. So and actually for the discs to be able to get more fluid in and out, that's actually how that fluid happens if I move. If I stay still, things don't happen. So staying still was the thing of the 80s. That has changed. We've actually also changed in our practice on doing that. So what we're now encouraging patients to do is keeping moving. So this is one of the tools actually that we use as a simple tool. We use it not only for persons with lower limb issues, but we also use it for people with upper limb issues as well, and for people with back and neck pain as well. So as we were talking about physiotherapy before, since we look at the entire body in this year and a few years ago, we actually focused on lower back pain as one of our main sources of patient load, for want of a better expression. I'm about to say main income. So the incoming patient, usually a lot of them have back pain, and we're looking at different tools that we can get them in to be able to use in their home environment to get functional.
Okay.
So that's one of the things that we highlight during World Physiotherapy Awareness Day. So this is now, the topic is one that the world body has chosen for us to pay attention to. Last year, you all have attended our arthritis symposium. A few years ago, we had Crack Your Back. And this year, I definitely want you all to look out. We may have some stuff happening online to be able to have more persons be able to attend the events so that you can actually get some more information from us. Also looking out for our releases on Instagram and Facebook related to lower back pain and simple things to manage your pain. And we may even have a competition, but you have to keep paying attention to our site to find that out. So check and see if you know the answers to our myths, just like we did this morning. That was just 2. There are a lot more. So check the information that's being released over the next few weeks, and you may be able to win a prize related to that. You may be able to get into our services to find out some more information in different ways. So I really want you all to look forward to that. And so I'm just showing you a little bit more of what we're doing here.
Sure.
So the pedal exerciser is one. And we do have a few more pieces of equipment in here of interest that can also help for back. So we did speak about moving a bit better. And so getting back into walking, getting back into swimming, getting back into that form of aerobic type exercise is always healthier for persons to move. And they may say, oh, but I can't go for long. So we would actually take you through use of our treadmills in both the health center locations, Scarborough Health Center, and up at the hospital to be able to make sure that you can function really well, to be able to get back out to what you need to do.
And for Physiotherapy Awareness Day, can the public come in and witness some of these exercises? Can they do them themselves? You know, would they be able to visit you, Dr. De Bique, say, come to the outpatient clinic and say, I'm looking for Dr. De Bique, my lower back hurts? What can we expect as the public coming into the hospital for this day?
So what we've also been looking at is how does research show how we can help? And so we actually have a screening form that was actually identified from one of the research articles out out of Keele University that actually is a start back tool that we can use to screen whether you need to attend sessions like education sessions, whether you actually have to come in to specifically speak to a physiotherapist one-on-one, or if simple other education tools will help. That's one of the things that we are looking at incorporating into our services, so that if you come in with questions around that, as our physiotherapists are usually there Monday to Friday, 8 to 4, we'd be able to begin to answer questions. And when we have those information sessions available, we can actually let you all know or book you all in so that you can actually find out more information. And that's something that we're hoping to be able to provide over the next month, and certainly over the next few months, as we've done before.
Okay, and before we wrap up this lovely session, you all, I got my workout for today. I'm just saying, right? Before we wrap up, Dr. De Bique, when exactly is Physiotherapy Awareness Day?
Okay, so as a reminder, it's this Sunday. World Physiotherapy Awareness Day is this Sunday, and it is recognized around the world. So you'll see lots of information coming out from different spaces, private physiotherapists, public system physiotherapists, speaking about why they love what they do. And throughout this entire month, we're actually going to be letting persons know more and more. The National Physiotherapy Awareness Month actually was expanded over the last few years. It used to be just one day, and we thought people need to understand a bit more and be able to touch base with us a little bit more. So therefore, we've opened it up a little bit to be able to allow you to be able to be in touch with us as well. So to find us, we're down at Scarborough Health Center. That's our main outpatient location. So most persons will actually go to that location to see physiotherapists there. And that location is headed by Dr. Kenise Evans and her team. And up at the hospital, we have a small outpatient physiotherapy department, and here we see most of our outpatients leaving the hospital just after having surgery. We have another location set up out at the Stroke and Diabetes Center. We have a physiotherapist out from our services running there. So we specialize services specific to persons who have strokes, and all of these places we deal with back pain. So we're looking at how we manage back pain after stroke, back pain after normal activities, back pain after lying down in a hospital bed for a while, and also acute back pain that you may come into accident and emergency with. We also see people on the ward, so we do have persons who come on the ward with back pain, and there are times when you do need to seek your medical help, and that's your doctor to be able to refer you in, and we see you on the ward to be able to help you begin to move as well.
All right, viewers. So Dr. De Bique, before we go, there was this exercise that you had me doing beforehand. Let me tell you, Dr. De Bique had to make sure that I was physically capable of doing these things. I have not done these things in a very long while. All right, so Dr. De Bique, do you want to show them that demonstration before we go? Maybe they can do it on their beds when they are at home, before they get up, before they have to struggle to, as you said, sit on the toilet or probably pelt the neighbor's goats. Do you want to go through that exercise before we go?
And these are actually easy exercises that you can do at your desk as well during the day. So someday just moving and you find your back feels a little uncomfortable, lifting your arms up, don't need any weights. You can do it just like this, a simple 5. As you're doing it with me, if you try it now, you will feel a difference. You come up into extension, so it does change how your back feels. So that's number 1. The second one is to open your arms out. So those were your T's. The ones I just did before were your I's. And just moving like this helps you as well. And another one I could pop in is Y's. So remember YMCA, that movement there also helps you with lower back as well. So it really does change a bit of your movement. And those are simple ones that you can do throughout the day. Don't do more than 5 at a time because you'll get a little tired. But you will begin to feel much better and a change, even if you can't get up from the chair. And that's also something you can do standing up as well.
All right. Thank you so much, Dr. De Bique. So for our viewers with lower back pain, and for those who are interested in the more wider topic, and that is Physiotherapy Awareness Day, we invite you to
check our website,
All right.
TRHA Facebook page, Instagram page. We're going to be releasing a lot of information over the next few days. I don't want to let everything out, but you've got a little snippet, and we'll see what we can do to check in with you over the next few weeks.
So to learn more, you can visit Dr. De Bique's, or that is the TRHA's website, and you can find the information on physiotherapy. So to our viewers, thank you so much for tuning in. Thank you for staying with me as I go through my exercises. I hope that you get through your day and that your exercises are well done throughout the day, just as Dr. De Bique showed you, and even after work or in the morning, tomorrow morning, God's Spare Life. So before I go, I just want to thank you so much once again, Dr. De Bique, for showing us through physiotherapy at Scarborough General Hospital, and of course available in our other locations across Tobago. Right? Thank you so much. And one more time, good morning, Tobago.
Morning.
Welcome back to GMT. Good morning, Tobago. I am your host, Natalya Nancis. You may be wondering where GMT brought you this morning. I want to welcome you to the Scarborough General Hospital Physiotherapy Department. I am joined with Dr. Karielle
De Bique.
De Bique. Good morning, Dr. De Bique. How are you?
Good morning.
All right. So Dr. De Bique has some exciting news for you. It's World Physiotherapy Awareness Day. She'll tell you the when, she'll tell you the where, and she'll tell you what you can do as a physiotherapist or as a patient. I'll be your patient this morning, fortunately, and Dr. De Bique will, of course, be your doctor using those demonstrations. But before we get into that, I want Dr. De Bique to just tell us a little bit about what physiotherapy is.
So physiotherapy is about movement and exercise, and we're those specialists within the healthcare profession. So we work on giving you a specialized, individualized exercise program or movement program for those who tend to think, oh, wow, exercise I hate. But we look at movement and helping you to get back to the function you want. So that will be I'm out gardening and I suddenly have pain, or I notice pain after I've finished picking mangoes. Usually that's it. Or somebody throwing that, like you had a goat in your yard that it wasn't yours, and you decided to stone the goat. That was my usual bit of information for patients and history.
Really?
With people who had elbow pain or neck pain or shoulder pain. So they stoned the goat to get it out of the yard, and then boom, suddenly I have a lot more pain, and they would refer them to physiotherapy. So we work you through how to get back to your function and to help you get back to life. Not necessarily to stone the goat again, but definitely to get moving without as much discomfort.
All right, so I haven't stoned any goats, but for those of you who do not know Dr. De Bique, I'd like her to introduce herself, what her position is, and how she's qualified to actually take you through physiotherapy.
Okay, hi, Tobago again. My name is Karielle De Bique. I have been in Tobago since March 2001, where I came in as the first physiotherapist to work with the TRHA before the physiotherapists were hired with the THA. And since then, we have developed a space into more spaces to be able to provide services. I would have received my first degree in Jamaica at the University Hospital of the West Indies, and that since has moved on to a bachelor's program at UWI. And so most persons, if not all the physiotherapists definitely who have been working with the TRHA, have done their training at that facility. And then after that, I would have received a bursary to be able to go to Australia to do my postgrad diploma. And then, of course, because school is always fun, I would have done further training, and now I have my postgrad doctorate in physical therapy, and that was out of Nova Southeastern University in Florida. So I've done all of those while working in Tobago. So the last degree I would have been doing while remotely. So we go up for training, and then everything else you're doing online.
Okay. All right. So when is Physiotherapy Awareness Day, or should I say Physiotherapy Week? Because I'm here standing. I don't think today's Physiotherapy Day.
No, this is actually to bring awareness, because usually in September, you usually see us do some fun stuff.
Yes.
So Physiotherapy Awareness Day actually is on Sunday. So we're here a little bit early to let you all know to remember your physiotherapist, remember what they do, and remember what you're supposed to do to keep yourself moving as well. Do a shout out to your physiotherapist say hi. I heard everything is going up in your department, and so I just wanted to say hi and say thank you very much for what you've been doing. Or just to show us, you don't have to tell us thank you, but you could show us what you're able to do now. So that's always a nice way to let us know what's going on. We're going to be recognizing this nationally throughout the month, and therefore there'll be different things happening around the country at different departments as well. So Trinidad and Tobago, look out for information coming out of your departments to find out what's going on.
Okay. All right. So let's look at some myths that people have about physiotherapists. And while we're looking at those myths, you see Dr. De Bique's face. Physiotherapists don't only offer massages, guys. They offer much more than that. They're very instrumental in actually bringing patients back to where, at least close to where they have been before, right? So we'll go into some of those myths that people do have about physiotherapists, and actually what do physiotherapists do beside massages.
Okay, so let's see. Let's do a little question and answer thing. Okay. So let's see if you will say this is a myth or if this is not a myth. I'm getting older. I must have back pain.
You must have back pain.
Mm-hmm. Is that a myth or is that a fact?
I would say myth because I'm young and having back pain. So let's go.
Right, definitely. So getting older does not necessarily equate to having back pain. There are a lot of persons that I'm sure are watching us now who don't necessarily have back pain. But back pain does come and go as you live life. So we actually have young people with back pain. A lot of persons don't think about it. A lot of the adolescents, as we're going through growth spurts, have some recurrent back pain on and off, and we don't really pay attention to it, or they don't think they're supposed to necessarily tell you. They just think, well, probably I was carrying the bag funny, or I was pushing things around the yard, and therefore that might be the reason.
Or pelting goats.
Oh, right.
Don't forget pelting goats.
Right, don't forget, or riding on the bike and I fell, or I was running and fell playing football. So a lot of times we don't really think about that as a possibility. Mm-hmm. So we're recognizing that back pain can happen anytime throughout your life. And what we really wanted to look at over the next few weeks would be really telling you a little bit more about when you should get help and what you should pay attention to. As back pain can come and it could usually resolve on its own within a few weeks. So it may not necessarily need to be seen by a doctor or even need the attention of a physiotherapist. So we're here to tell you what you could do to prevent it, to manage it over the next few weeks, as well as how to pay attention if there's something serious.
Right. So you have a lot to offer over the next few weeks. Mm-hmm. Today, I have the privilege of going through some of those back exercises because I do walk around a lot. That puts pressure on my back. I don't know about yours. And there are some people who may be sitting in the office space as well for very long periods, typing on these things. So Dr. De Bique will actually be using me as her patient to show you some exercises that you can go through so that you will not experience that much back pain or no back pain at all, because, you know, Dr. De Bique is good in what she does, right? So let's begin.
Okay, so let's think. We got off the bed this morning. Oh, I feel a little bit of discomfort. I reached to the toilet and I sat down. Mm-hmm. So let's have a seat here.
Okay.
All right. What are some simple things we could do to make sure that our back keeps moving? Let's use letters. That's an easy way to do it. So we're going to make an I. The intention is to take your arms up overhead. As you lift up overhead, you will feel some movement at your upper and lower back. So lifting your arms up overhead. You notice that she begins to arch a little bit back, and then she brings her arms back down. That movement can actually help with muscle action to the back of her. So right along the lower back here, she should begin to feel the scapula move down and in as she continues the movement, right? So it's down and in and then back down. So you can do about 5 of those when you start off the day, just to make sure we're going okay. And another thing that you can do is a bit of a stretch. Okay. So we're turning with this movement now. So you're holding on to the side of your thigh and turning. So as you do this, you're just kind of waking up, lengthening the back a little bit. And then she turns to the other side, hold on to the side, and lengthens a little bit. So she's going to get a nice stretch as she does it on either side.
I am getting a nice stretch.
So that stretches down here. And as she turns, down the lower back. So we're mobilizing your back a little bit as we go. So if we're thinking of lower back being your guide, a lot of people are like, oh, is something wrong with my disc? Is something wrong with my muscles? Is something wrong with my nerves? Sometimes we're never sure of exactly what is the cause of your back pain. So as she turns, you can see the movement happening at the joint. You can see a little bit of different pressure changing. This yellow thing is the nerve. You're seeing that there's some movement around the disc area there. So as we go through your movements in our assessment, we'll be able to work out what are the things that that with movement it will assist. We don't have eyes to be able to see in as you're moving at the time, but we certainly can help you move a lot of those structures and therefore get some relief because you're sitting in a position for long.
So that is left to right.
Usually called seated trunk rotations.
Seated trunk rotations.
And an easy way to do this, if when you get up in the morning, it's a little discomfort, there's an option to do it in lying as well. So that is also an option that we can show a little bit later. So another thing that you can do, another exercise that she can do in this position is one to be able to help muscles more to the center here. And she's going to start it like this. It's called the T's. So you can imagine me center, arms moving out, that's a T. She's going to do that. So the elbows stay close to her side. They come up at 90 and she opens her arms out to the side. I'm going to bring a resistance band to help with that. A nice light one for today. For those of us who find that this is relatively easy, I would suggest that you start with it first, no resistance, and then begin to add a light band. So she's going to wrap this around her hands. Like this, grab hold, and then she's going to open again. Same movement, nice and slow. And now she has the resistance pulling, so she's really going to feel it now at the small of her back, right? So our intent today is do some simple things to keep your back moving well, and therefore keeping your function happening, right?
Right. Okay, so before we continue on, I know a lot of us are now into it. We want to know what exactly to do on the morning when we get up and we feel in this back pain. We want to use the toilet in peace, right? So before we continue on this morning, we'd like to take a short break and we'll be right back.
See you.
Ooh, all right.
Yeah.
It's a brand new morning, rise up to a brand new dawn, and as the passion start to rise.